Right, good morning everyone, and thank you very much for inviting me to be part of this incredibly important symposium in Cambridge. My task is to talk about global strategies to reduce violence against children, and I am starting with my first slide that presents a number of different hats I have. Now, the goal of this isn't to make you all feel sorry for me about being overworked, but what I really would like to do is to draw your attention to two of these, because apart from my role at the Medical Research Council in South Africa, I'm the Secretary of the Sexual Violence Research Initiative. And I would like to suggest that all of you who are in the audience who are not familiar with the Sexual Violence Research Initiative might want to have a look at the website, which is svri.org, so it's easy to remember, because this is a key platform for global networking of researchers in the area of sexual violence, and we hold a conference every 2 years, the next one in Cape Town next year. So if you're interested, please have a look at that. The second title I want to draw your attention to is the bottom one, and I'm the director of a new DFID-funded flagship program, which is called What Works to Prevent Violence. And the part of it that I'm heading up and working with a number of other partners, including Charlotte Watts and the London School, who are in the audience, is the global program, and we're working across 28 DFID priority countries to try and explore what works to prevent violence and to try and generate evidence and put it into the arena for research uptake and build capacity within low and middle income countries around violence prevention. So I want to flag these too. But first of all, today, my task is really to talk about how we could and what we need to do in order to start thinking about how we could reduce violence against women by 50%. And I want to talk to you chiefly about the role of primary prevention. And in order to do this, I want to start with some television, a video. So if I could just have help to put the video on.
Let me help you.
This video I'm going to show you has been produced as part of the What Works programme. And if any of you think that's not the beginning.
Yeah. Press play,
Okay.
It's going to come back. No worries.
If any of you would like to use it, it's actually very clever. It's on the internet and can be downloaded and used. Gosh, apples are amazing. You can just play.
In school, my teacher says that throughout history, people have often taken a stand against oppression and violence in lots of different ways. People joining together, trying to change laws. People teaching self-control and peaceful resolution. People demonstrating courage and perseverance. All of these men and women stepping up, trying to change society for the better, because they know that it just can't stay the way it is. A third of all women experience physical or sexual violence, or both, by a male intimate partner in their lifetime. Globally, nearly 1 in 10 women have experienced sexual violence by a man who is not their partner. And in many places, it's much higher. Individuals and organizations have been working hard to help women who have experienced such violence. But that isn't enough. Overall, the rates of violence have not decreased in that time. I myself have seen it here, in this center. A never-ending flow of women, all of whom have suffered deeply. It was then that I realized that we need to consider prevention as well as just a response, stopping the violence before it starts. The figures across the world are astonishing. Prevention is the key, and we need to do more of it, and in a more organized way, And it all starts with solid data. I'm not talking just numbers on a screen. I'm talking listening to people's stories, looking for the underlying causes, where it all began. Looking at how the circle of childhood violence comes around again in adulthood, and how alcohol can be a trigger for aggressive behavior. Seeing that a man's belief that he has the right to control women leads to more than just psychological harm, and how boys are often taught that to be a man, they need to be tough and dominant. We are all different, but there are most definitely common drivers leading to violence. There is nothing supernatural at work here. It's cause and effect. And based on our data, we can start to address some of these causes properly. Putting interventions in place, whether that's in schools, promoting healthy relationships in families, teaching positive parenting skills, with groups of boys being taught that strength comes not through violence, but from moral courage and respect. Communities taking a stand to say violence is unacceptable. And not just here, but in every country, all over the world. And then we have a chance at changing the present, which will help to change the future. My future.
Thanks. I hope you can see from this video almost everything that actually I really want to communicate with you today. The first of which is that our primary task is primary prevention. The second is that we know what the risk factors for violence against women are, and actually they intersect in an incredibly close way with all other forms of violence. And so what we need to do in order to really be able to achieve global targets to reduce violence by 50% is to recognise the intersections, recognise the synergies, and make sure that all of the efforts that we put in are pulling in the same direction and the right direction, and that we're not putting efforts into competing against ourselves. I think that we need to recognise that primary prevention really needs to be central in what we're doing. But we have to build a knowledge platform for primary prevention. We have to understand how to use evidence to develop stronger interventions, to evaluate interventions and develop an intervention pipeline, and to disseminate knowledge and scale up. So let me talk to you about what I mean by violence against women. The largest one of these circles highlights the area of intimate partner violence, physical, sexual, and emotional violence. And I think we have good evidence globally that this is the single most highly prevalent form of violence. But these circles are not accidentally overlapping, because the area of non-partner sexual violence and sexual abuse in childhood is both a very important form of violence against women, but also a form of violence against women that very substantially overlaps with intimate partner violence. So we know that people who are abused in childhood are much more likely to experience intimate partner violence subsequently. We know they're also more likely to experience non-partner sexual abuse when they're older. We know that there are a range of other forms of violence against women and girls that very often don't get given anything like as much attention. Forms such as sexual slavery, trafficking of women for sex, female genital mutilation, child marriage, and traditional cultural practices. In South Africa, we have a traditional practice called ukutwala, which is essentially a wife abduction process that occurs that results in coerced marriage. And in the other example I put up here is swara, is a Pashtun practice whereby communities agree to give a girl child in compensation after an act of violence or killing or whatever between different communities or clans. And I think one of the things that's important here is that whilst we very often segment them, so for example, DFID has a child marriage prevention strategy, which is a program at the moment, and an FGM program, which are different from our What Works programs, which are focusing on IPV and sexual violence. These are all very, very closely interrelated. So the process of child marriage obviously is a form of child abuse and obviously results in essentially in rape of a child. Very often those children are much more vulnerable to physical violence, both from their partners and from other people within the new marital home. The same as Uktwala, which results in rape and very often violence as well, and Swara too. And the same can be said for FGM. It occurs within a context of patriarchy, a context where women have very much fewer social and political rights, and therefore are much more vulnerable to the whole package of other forms of abuse. The way I've just presented this as well, I hope will convey to you that when we're really talking about girls, I really think the distinction between, or when we talk about violence against people who are female, if you like, the distinction between women and girls is a false one. We have a UN definition of 18, but all of child marriage, which essentially is marriage is usually a transition into adulthood, however young it occurs to people who are below the age of 18 by definition. FGM is normally people below the age of 18. Sexual abuse in childhood is most highly prevalent in the teenage years before the age of 18. And when we look at the drivers of these, in fact, there's enormous overlap between the drivers of perpetration of child sexual abuse and the drivers of perpetration of non-partner sexual violence. So the distinction doesn't make sense. We're essentially dealing with problems that are incredibly closely interrelated. And I think that one key message in terms of the way forward is to break down these distinctions, which hinder our working and create a context of competition between people who are approaching violence from different ways. However, I want to say that globally intimate partner and non-partner sexual violence, whether occurring to children or to people who are older, are the most highly prevalent forms of violence against women. So I'm chiefly going to refer to them now. I think our little video highlighted some of the evidence that we have around the prevalence of intimate partner violence. This slide comes from the Global Burden of Disease study that was published last year, led by Charlotte and her colleagues at the London School and Claudia Garcia Moreno. And I think one of the things that's interesting here is, first of all, we now have enough data to actually be able to talk about prevalence in a meaningful way for different global regions. But secondly, I think it's really important to highlight the fact that in high-income countries, the data provides a prevalence of ever having experienced intimate partner physical or sexual violence of 23%. And that is very high, and it's not very much lower than the sort of prevalences of 37% or so that we're getting in the highest global regions. So really this is a problem that cuts across all global regions, notwithstanding the fact that there has been a decline in the United States. When we look at non-partner sexual violence, again, the evidence is less good. It actually isn't as much of it as there is for intimate partner violence. But a review of published estimates of women's exposure to this suggests 7% of women worldwide have been exposed to non-partner sexual violence. The range obviously depends on where you live in the world, and here it's very much larger, with only 3% of women in South Asia compared to 21% of women in Central Sub-Saharan Africa having experienced this form of violence. I think it's very interesting that the evidence from women is very much, and population-based samples of women, is very much more sort of a very much larger body of work than the work which we have on the prevalence of self-reported perpetration by men in population-based studies. And this is an area where, until very recently, violence researchers had a huge reluctance to actually go out there and ask about perpetration in this particular context. Globally, the biggest body of literature is really the North American college studies, and there are very many countries in the world where there never has been population-based research on male perpetration, particularly of sexual violence. Where we have done it, we are really stunned by how high the prevalence of self-disclosed rape of non-partners is. South Africa is a case in point where 21% of men in the study we conducted in 2008 disclosed having ever raped a non-partner. And in fact, 9%, so it's nearly 1 in 10, had raped with multiple perpetrators, i.e. they'd done a gang rape. And in fact, another 10% had been involved in gang rapes, but they hadn't had sex. In a multi-country study we conducted, this was led by Partners for Prevention, which is UNDP, UNFPA and UN volunteers from the Asia Pacific office. This study conducted research in 9 settings in 6 countries and found that the prevalence of non-partner rape reported by men ranged from about 4% in urban Bangladesh to 41% in Bougainville in Papua New Guinea. So we have, and I think overall, even if you look at 4%, we think, well, that's not very high, 4% is okay. But that's 1 in 20, nearly 1 in 20 men who've raped a non-partner. These figures are way, way higher than I think people had previously anticipated, where rape is seen as being this unusual act that gets reported and published in the newspaper when cases occur and come in. And this really provides a totally different context for thinking about prevention. So what is it that we have to do? Well, I think that one of the key tasks is that we have to build a better knowledge platform. It's not just about doing more studies, it's not just about replicating our prevalence studies in more countries, but I think that in order to really prevent violence, we have to change the way in which we think about knowledge in violence prevention. We need much more interdisciplinary research so that we can build on the strengths of different disciplines and overcome the limitations of different perspectives. And as somebody who's used epidemiology a lot, I'm going to put forward, sort of a key limitation from epidemiology, which is that standard epidemiological approaches have focused on elucidating and providing lists of risk factors, for example, but have not focused on looking at pathways between and the interconnections between risk factors, which is absolutely critical for us to think about the most effective ways of taking forward and building prevention. Standard epidemiology often accentuates differences between types of violence because of the need to operationalize definitions in particular ways, rather than helping us understand better the commonalities and the overlaps between different forms of violence. And I think that one of the underlying reasons here has been that we're trying to reduce behaviour into measurable units. And there's been a reluctance to pursue avenues of analysis which can deepen understanding, particularly thinking about latent and unmeasurable constructs, such as constructions of masculinity and femininity. And indeed, the whole body of literature around notions of masculinity and femininity is very much rooted within social science. And I think one of the key limitations of knowledge in our field is the way that we are very often bound within disciplines, and there really is a need for much more work, not only collaborating between disciplines, but also of people actually reading literature produced by different disciplines, so that we can operationalize notions developed within gender theory and social science, within domains of epidemiology or criminology. And that is absolutely critical to fundamentally breaking down silos. I want to give you an example. I think in epidemiology, shopping lists of risk factors, unless they're very carefully interpreted, can actually hinder our understanding. And I'm going to show you this, which is a classical shopping list of risk factors, particularly if you exclude the left-hand column. Now, this table is a multinomial regression model of factors associated with non-partner rape perpetration. And the analysis was based on the over 9,000 men we had in the Asia-Pacific study. And this is the first time that we've ever been able to use a large population-based study to actually consider questions about the difference between multiple perpetrator rape, gang rape, and single perpetrator rape, and whether actually these are, in fact, two halves of the same coin, if you like, or whether there may be different things that we have to think about in terms of prevention. So that's what this analysis was trying to do. And because this was a big data set, we were able to, had the power to actually develop models that I think inevitably had quite a lot of risk factors in it purely because of the power of the model. Now, we could sit here and we could look at the different risk factors. Actually, having ever been married is a risk factor for ever having raped a non-partner. So perhaps we should stop marriage. That would be an easy solution. Or have more divorce. The Maldives has a particularly high divorce rate and one of the world's lowest prevalences of violence. So actually, being able to dissolve marriages can be useful. But we need to understand what we're thinking about in terms of risk factors. Because in fact, if we look at high school education or absence of it, food insecurity as a group, what we're basically looking at are indicators of social marginalisation. And I would like to suggest that in rape perpetration, it's actually the social marginalisation as a group that we need to be looking at. And that we need to be, we would need to know a lot more about whether actually providing food or the wherewithal not to be hungry on its own is going to prevent multiple perpetrator rape, or whether what we need is a package of intervention that actually deals with the fact that people, even within these contexts that we're looking at in Asia and Pacific, people who have less education, are essentially more poor, actually are less able to engage in the mainstream and exert power within society. The same for victimisation. I'll put up here, if I can just go backwards, that we actually measured and showed that a range of different forms of victimisation of other forms of violence, child sexual abuse, physical abuse, emotional abuse and neglect, were associated with a higher risk of raping, as well as exposure to homophobic abuse and violence, which again provides good evidence of the overlap. And I think that really what we're looking here, which I don't need to reiterate, is the overlap between these forms of violence and the need to prevent violence in childhood as a way of preventing later violence. We have alcohol problems and empathy, which may be mediated through alcohol's lack of judgment, impact on judgment, perceptions of entitlement and power as well. And then there's a risk factor group which relate to relations of women. Men who rape are more likely to be physically violent towards women. They're also more likely to have many more sexual partners and to have had sex with a sex worker. Now, I don't think, again, that preventing men having sex with a sex worker is going to prevent rape. I think that what we're dealing with here is underlying ideas of masculinity, that men should be strong, tough, in control of women and women's bodies, and a reification of the sort of glorified heterosexual man who's sexually dominant, and this is sort of indicated by their sort of readiness always to have sex, including if they have to pay for it, as well as having large numbers of sexual partners. I want to suggest it's this underlying idea of masculinity, which again provides a unifying framework for understanding why there may be common roots between male violence between men and male violence against women that we actually need to change.
5 minutes.
And we need to, we have a group of other forms of violence. Fighting with men who fight with weapons involved with gangs and drug use are also much more likely to rape. And again, this reflects the underlying masculinity. I think we need to strengthen our understanding of how to use evidence in developing interventions. We need to build an understanding of the importance of systematically building interventions and theoretically driving them with strong theories of change. I think that now, what I've seen over the last few years is the notion of a theory of change is becoming much more accepted. But in fact, people's understanding of what that actually means is very weak. And even when we actually get people to identify what are the risk factors you might need to might be driving an intervention or you might need to impact on them, there's often a sort of sense that a difficulty in jumping between that and actually building an intervention. And I would like to suggest that's because we need to build a much greater understanding about how to use theory in developing interventions, what types of knowledge need to be drawn on. If we want to impact on gender equality, how can you use gender theory to build a better intervention? And what methods are most appropriate for engaging people in processes of behaviour change in different environments, as well as the complexity of context. And I want to suggest that we need to know whether preventing the most severe forms of violence requires the same intervention as preventing violence that may be of a less severe form. And we need to know whether preventing in the most disunited communities, post-conflict, the communities with the most high sort of general social norms around the use of violence in all forms of gender relations, whether in those communities the same interventions are needed as in communities that use violence but generally are less violent. We need to generate a knowledge pipeline. When we look across public health at other areas, particularly the world of drug discovery, what we see is knowledge pipelines where there is an enormous number of interventions that get into early stage concept. A very much smaller number go into preclinical development, and after initial testing, a very much smaller number get taken forward. So final RCTs are conducted on a very small proportion of potential candidates. We do not have any form of equivalent structure in the field of violence, and I think that we really need it. Studies are highly complex, highly costly and complex to manage. And I think it is essential that also that we replicate and understand how to adapt them for different settings. But we need to be able to really build our knowledge on early findings and learn how to optimize interventions. And if you look at the approach to the development of our evidence base at the moment, in fact, the evidence around preclinical work and the number of interventions that get rejected or get revised 30 times before they get taken to RCTs is extraordinarily small. In fact, there may have been very few of these ever. And I think that if we don't become more systematic in the way that we develop interventions and test them, we're not going to be able to optimize our violence prevention interventions. We need centers of excellence for this. We need coordinated trials and testing, human resources, and we need strong funding streams. We also need to look at a key knowledge dissemination and scale up. A key element of our programme, What Works to Prevent Violence, is on disseminating knowledge. And the first step is on building understanding of what is primary prevention. That's why we made the video, because when I talk to policymakers, they don't know what it is. We've been trying to build knowledge in the women's field. I find in the children's field, the idea that providing a social worker to handle a case of abuse that's already taken place is not primary prevention. The idea that actually what we really need get first prize for is stopping that abuse ever happening in the first place is something that's very poorly understood. And we're never going to get what we need to actually prevent violence if we don't spread understanding and develop knowledge of what we actually mean about stopping violence before it ever happens. And actually also building an understanding that this is something that's achievable and that this is possible. We also need to develop a way of understanding how we combine interventions at a population level, particularly because this is something that is complex and we need delivery platforms for it. We need institutional mechanisms within countries for doing this, which do not currently exist in most countries that I'm familiar with, any country I'm familiar with. And critically, we need to understand costs. So there are a whole range of pieces of the policy puzzle, but also of how to build interventions and services and deliver them, that we have not got to the stage of being able to properly understand and address, that we need to do so if we're to achieve our goal. So just to conclude, I want to suggest that the central requirement for effective work to reduce violence against women by 50% is to reduce fragmentation in the field. We need to reduce fragmentation across forms of violence, across academic disciplines. We need to link theorists and practitioners and people who do evaluations. And above all, we need to link in policymakers. We cannot work at a national level without engaging governments. And frankly, one of the most important ways of doing this is that we will not prevent violence if we can't get governments to fund violence prevention. We can't reduce violence by 50% in the world if we're using money from foundations and from bilateral donors as the platform for doing this. So we have to completely change the way in which violence programming is funded. And we also need to change the way in which research and development of interventions in violence prevention is funded, because we need to massively scale this up if we are to be able to generate the knowledge both of what we should be doing and what works and how to optimize what we are trying to do. And it is only through these ways that we will manage to achieve our goal. Thank you.